Hello, I'm Dr. Angela DeRosa, and I'm an internal medicine physician, but my primary interest and passion is hormonal health for not only women, but also for men. Of special interest, whenever we talk about hormones, we often forget about the little old thyroid that sits in our neck. And the thyroid is really the metabolic driver of our body. So imagine your body's a car, the thyroid is the engine that gets it up and running every morning. So when you're talking about driving around in a car, we often want to be in that BMW, Lexus, or Mercedes. We don't want to be in a go-kart, and certainly being in a Formula One race car on a day-to-day basis is not good either. So what we're trying to get is that optimum metabolism and drive every day from our thyroid. But the main problem is that a lot of people don't realize the signs and symptoms of having a low thyroid, which is actually the most common disorder of the thyroid, and in addition, most providers don't know how to properly screen for it. So let's run through the symptoms. First and foremost, extreme fatigue is one of the prime symptoms that we see in hypothyroidism. But obviously a lot of other things can lead to fatigue as well, so you have to look at other things. So the other things we look at are hair thinning, hair falling out in clumps. You may notice that you're getting more constipated than usual. Your skin gets very dry. You may notice swelling in your hands and feet. You're cold all the time. And the real strong symptom we see is there's extreme weight gain, in particularly in those people who work out properly and eat a good diet on a day-to-day basis. No matter what you do, you can't seem to shed those pounds. So you take all those symptoms together, and if you have a large majority of them, there's a strong possibility that you're hypothyroid. Here's the other kicker, is it's very common in women. About 1 in 3 of us are going to have a low thyroid by the time we're 50. So we need to look for this, and we need to look for it very closely. But again, as I mentioned earlier, when most physicians look at thyroid levels, they're looking at the wrong thing, or they're not looking at it properly. So I hear patients coming in, I think I have hypothyroidism, I have all the symptoms. I examine them, and certainly they have clinical signs, which include low heart rate, their temperature is kind of on the low side, and again, they're usually overweight. But the typical lab that most providers look at is called a TSH, or thyroid stimulating hormone. Unfortunately, it's only a screen, and it has a range of usually 0.45 to 4.5. Most doctors say if you're in that range, you must be normal. But again, we're all unique individuals, and what may be good for one of us may not necessarily be good for another. In addition, that reference range, or that screening test, can often be wrong if your other hormones such as estrogen or testosterone are mixed up as well. So it's not necessarily reliable. So in our office, what we like to check is not only that TSH, it is a good screen, but more importantly, we check a T4 level, a free T3 level, and a reverse T3. The T4 level is actually measuring what the thyroid actually secretes. Free T3 level is actually needed to convert it from T4 to T3, because T3 is the active molecule. And if you don't get it converted to that, you would still have hypothyroid symptoms. So it's important not to get into all that diagnosis, but going to physicians who understand the differences between those levels and how to properly interpret them. Because most often, if you think you're hypothyroid, you most likely are. The good news is that it's a very easily treated disorder. We treat with thyroid replacement. And what we like to use is bioidentical natural thyroid replacement with either Armour thyroid or Nature thyroid. Synthroid and Cytomel can also be used, but we use those in select cases. But if you're concerned about any of these disorders, come and talk to us. We're experts at dealing with this disorder, and we can help you.